third recommendation in the report is to expand home visitation programs for new parents. Home visitation services are particularly important for new parents who need good information about their child's development as they navigate the experience of parenthood. Early intervention services are also important, including home visits that help parents who have children with developmental challenges create the best possible learning and stimulating environments for them. Research shows quality home visiting programs reduce child abuse and neglect and infant mortality, and they result in increased immunization rates and parental knowledge of children's developmental needs. Evidence-based home visiting programs should be an integral part of strategic efforts to improve outcomes for Tennessee's youngest children, and especially made available for young children who are at risk. Tennessee has taken advantage of federal dollars through the Affordable Care Act to significantly expand home visiting programs in Tennessee, yet we are still far from meeting the needs of all vulnerable children and their families. The Commission is particularly concerned about state funding for Healthy Start and Child Health and Development home visiting programs that are currently funded through the Department of Health with non-recurring dollars. We urge Governor Haslam and the General Assembly to ensure these critical programs continue even if they once again have non-recurring funding. What is important is that families that are often struggling, parents and infants, have access to these important resources that can help them be successful. The fourth recommendation in the report is for the state to develop strategies to prevent or reduce the effects of adverse childhood experiences. Referred to as ACEs, they're the toxic stress that Lisa talked about and I've talked about earlier. The impact of ACEs, the trauma and toxic stresses of persistent poverty, severe maternal depression, abuse and neglect, divorce, death, incarceration, substance abuse, many other traumatic experiences, has been well documented. Research continues to demonstrate that multiple ACEs, especially in early childhood, can create toxic stress that literally affects brain structure and carries lifelong consequences. A higher number of ACEs and other family stressors are associated with negative health, educational, and economic outcomes over a lifetime. Addressing these underlying issues in Tennessee by preventing and providing appropriate therapeutic responses to ACEs, to trauma, to toxic stress is essential in creating long-term solutions to the many intergenerational problems Tennessee children and families face. Many of the systems serving children and families in Tennessee are becoming more trauma-focused or trauma-informed. This means they're recognizing that the childhood and later traumas as major underlying factors in a variety of health, mental health, and other problems. Preventing and addressing trauma and toxic stress and the toxic stress it precipitates is important for the future of children and the long-term health and well-being of the state. In addition to the focus on young children in this Kids Count in the State of the Child report, there are 41 tables of data reflecting child, family, and community well-being or demographics. And the first time we've included in this report on many of these tables a box that shows the statewide change in that indicator over the years. As we close, I want to again thank the Nashville Public Library, Mary Nell Bryan, and Lisa Wiltshire. I want to thank the staff of the Commission on Children and Youth who did such a great job putting this report together and this event. And thank you for being here, for your interest in and coverage of issues important to Tennessee's children. They are Tennessee's future.